Hello, welcome back to Long COVID Real Talk podcast, where we explore the real, raw, and often overlooked experiences of living with long COVID. I'm your host, Catherine Marie, a nurse practitioner, social worker, and someone personally navigating life with this condition. Today, we're diving into something so many of us had faced, but don't always have the words for. Medical gaslighting. If you've ever left an appointment feeling dismissed, doubted, or dehumanized, this episode is for you. What is medical gaslighting? It occurs when a healthcare professional downplays or dismisses a patient's symptoms, often attributing them to anxiety, stress, or exaggeration, even when clear evidence suggests otherwise. And if you have long COVID, you probably know this feeling well. Maybe a provider has said, "It's just anxiety," or "You're too young to be this sick," or even, "Your labs are normal, there's nothing wrong." But you know your body, and it's really frustrating when no one believes what it's trying to tell you. Why long COVID patients are gaslit. Long COVID is an emerging, complex condition, and frankly, medicine hasn't caught up. There's no single diagnostic test, symptoms vary widely and often do not show up on labs or imaging. And on top of that, many of us with long COVID are women, BIPOC, LGBTQIA, disabled, or people with past trauma, mental health histories, or chronic illnesses. And that combination makes us more likely to be dismissed. And it's not just frustrating, it's harmful. It results in delayed diagnoses, inappropriate referrals, missed treatments, and emotional trauma that lasts long after the appointment ends. I'll share a personal example. I once told a provider about my ongoing fatigue, heart palpitations, and breathlessness. Their response, "We're all tired. You're just stressed. Take a walk." I left in tears, knowing that something was really wrong, and it was. I later was diagnosed with dysautonomia. And I know I'm not alone. One listener wrote in, "My doctor told me I was exaggerating my symptoms for attention. I used to be a runner. I couldn't walk across a room without getting dizzy. But I started to wonder if I was making it all up." You are not making it up. You are not alone, and it is not in your head. So what can you do when you feel gaslit? Here are a few tools and strategies. Document everything. Track your symptoms, vitals, reactions, even the way you're treated in visits. Bring an advocate, a friend, family member, or even another provider can help back you up. Ask for records. Review what was said about you. You have a right to your medical chart. Use your language. Say things like, "I feel unheard. I'm not comfortable leaving this visit without a next step." Can you document in the chart that you are declining this test or referral? And sometimes the best thing you can do is walk away. If a provider is causing more harm than help, you are allowed to fire them. To my fellow healthcare professionals, we have to do better. We're trained to look for answers and for certainty. But long COVID doesn't fit into a neat diagnostic box. It doesn't mean that the patient is wrong. It means we have to listen harder, believe more, and stay curious. Dismissal is traumatic, and for many of us, it comes from the very system that was supposed to care for us. You are not alone. You are not imagining this, and you deserve care that sees you, believes you, and fights for you. Thank you for being here with me today. If this episode hits home, please share it with someone who needs to hear it. Please leave a review and let me know your story. I'm listening. Until next time, take care of yourself, rest when you can, and remember that you matter. Thank you for listening, and we'll talk again real soon.